Hi guys, my name is Dr. Samir Islam, and today I want to discuss a new endoscopic treatment we have for obesity called Obalon. I want to ask, is Obalon right for me? And with this video, I hope to answer some of the questions you may have about Obalon, what it is, and who are the right patients who should get this particular procedure. So when we think about obesity, we know there's a huge epidemic within the United States with respect to obesity. It's a national health problem, and almost 1/3 of the US population is obese, and it is considered the largest and most pressing chronic medical problem in the country. And so if we look at Texas specifically, almost 1/3 of our population in Texas are obese, or they are classified as obese. And it's a significant problem causing a lot of long-term medical problems, including things like diabetes, heart problems, hypertension, and cancers. In fact, up to 13 different cancers are associated with obesity. It's a significant problem which has long-term complications for a lot of people who are not even aware of the long-term problems from obesity. Now, the other problem with obesity that a lot of people have is not the medical issues, but it's the social problems that occur with obesity. And these include things like not being able to play with your kids, being tired all the time when you do normal things, like when you go shopping, when you go to the mall or go to the grocery store, trying to find clothes that fit you when you don't have the right body shape or you're too overweight, or being embarrassed by your weight, or even having people stereotype you for being obese, whether it's not being clean or not being intelligent, or other problems that can occur socially when you have obesity. And these are the issues that I think a lot of people have when it comes to obesity, and this is what we're hoping to control or at least alleviate when we have these non-surgical options that we have for you. And one of the options that a lot of people do are medical and lifestyle, and for some patients is pretty effective. But even in the most ideal conditions, only 7 to 10% of your body weight can be reduced with only lifestyle intervention alone. This is only sustained in 5% of those people, and so 95% of the people who undergo lifestyle or medical options don't maintain that weight loss. I'm sure you're aware of that. I'm sure you've tried things like Weight Watchers, Jenny Craig, or exercise alone, and you've had results initially, but it's really hard to maintain those results over the long term, which is why a lot of people fail over and over again. The other spectrum is surgical, and it's a very effective option for people who want to do permanent changes within their body to help them reduce weight. But we do know that surgery alone has not been sufficient to bring back the obesity problem within the United States. And with surgery, there are inherent risks and benefits. You're undergoing a surgical procedure. There are inherent risks with performing the surgery. There are long-term complications that can occur. And there are risks in which having to change your anatomy in some way. And so for some people, they may not want to opt for the surgical treatment, which is where Obalon comes in. This is a very effective option for those people who have not hit their goals that they want to hit with lifestyle and medical alone, yet who do not want the drastic course of altering your anatomy with surgery. So what Obalon is that it is the first balloon that you can swallow without the need for anesthesia for weight loss. It's a non-surgical, non-anesthesia, swallowable balloon. And so what happens is that the patients swallow the balloon, and that little balloon is attached to a microcatheter. Once the balloon is confirmed to be in the stomach with digital imaging, we inflate the balloon and then we remove the microcatheter. It takes about 10 minutes, all outpatient, no surgery, no anesthesia needed to insert the balloon. Now, how does it work? It's FDA approved, it's non-surgical, and it's not permanent. We leave it in there for 6 months, and then 6 months later, we remove the balloon. Outpatient, no anesthesia to place, takes about 10 or 15 minutes. There's absolutely no downtime whatsoever. In fact, you can go back to work as soon as we're done. Very minimal side effects, if any. And it's 3 gas balloons that are placed over the course of a couple of weeks, and we leave them in there for a total of 6 months. And then 6 months later, we remove the balloons. And then you undergo a full year lifestyle coaching program for us to help you lose the weight that you want to lose and to maintain that weight loss as well. And it's a full lifestyle change that we're offering for our patients who want to undergo the Obalon therapy. It's a comprehensive lifestyle program for us to allow you to lose the weight that you want to lose and maintain that weight loss in the future. So the biggest question is, does this actually work? And now I have to say the answer is yes. You can lose up to 50 pounds, and 89% of the weight loss is maintained. And this is typically found to lose almost twice as much as just diet and exercise alone. So it's a very effective non-surgical procedure to help you lose the weight that you want to lose. Now, there are certain patients who should not undergo the Obalon therapy. These are those who have not tried anything else. So if you've not tried exercise or lifestyle, or you're not willing to undergo that in addition to Obalon, this is not the procedure for you. If you're not committed to the weight loss program with respect to seeing the nutritionist once a month for a full year, this is not the program for you as well. It will not work. You have to be committed to the program. It's that accountability for seeing somebody consistently that is key to allow us to help you lose the weight that you want to lose. If you've had prior stomach surgery in the past, this would not be the right procedure for you. If you have a very large hiatal hernia, this would not be the right procedure for you. If you're on any blood thinners and you can't get off of them, this would not be the right procedure for you. Now, the best patients for Obalon are those who are adults, who are roughly 30 to 100 pounds overweight, or hoping to lose that weight in a non-surgical manner. You have to be willing to follow a diet and exercise program. If you don't do this, you will not achieve the weight loss goal that you're hoping to lose. You have to be committed to a healthy diet and to an exercise plan. This is key in providing the accountability for you to lose the weight that you want to lose. And you must be ready to develop new lifestyle skills. It's a whole change we're offering for our patients who undergo Obalon. It's not just placing the balloon, best of luck, hope you do well. You have to be committed to our program to help you lose the weight. I want you to lose the weight that you want to lose. I want you to live a healthy lifestyle. In order for us to do that, you have to maintain the program that we offer for you. So please call us for more information. I would love to discuss with you any questions you may have. Feel free to call our office to make an appointment. The consultation's free, or you can visit my website at drislamweightloss.com for more information. I'd love to hear from you and look forward to us starting our weight loss journey together. Thanks and take care.